Hello, my name is Karen Kirkness, and we are here to talk about the axial matrix. It's great to have a look under the integumentary system. If I keep adding levels of integument, we can go right to most of the surface anatomy and then fast track our dissection process to move through those most superficial layers. And now we are coming to the deep fascial layer. We have a look at the cadaver in the round. So we'll just zoom in. And what I really want to draw our attention to first, to emphasize the integration of cross-ply myofascial fibers. And these are striations in the fascia. You can see that these are orthogonal, diagonal lines are running at a cross-ply relationship with one another. And that is probably the biggest takeaway of this video, is that we appreciate just how these striations are on the bias from one another, running through the weave. It isn't just an envelope where the fibers are on the outside containing wonders on the inside. Oh no, this is happening all the way through the weave, from superficial to deep. Let's look at some of the depth here as we go around the torso, which in 5 filaments rubric is the axial matrix. The color coding is helpful. Where you see white, so going even deeper into our image here, even closer, we'll zoom in. The whitish striations, that indicates a higher level of collagen. Connective tissue is denser. In the literature on the extracellular matrix, this is often referred to as tendinous tissue. The tendon in that classic nomenclature is where the muscle attaches to the bone. And we have something called tendinous insertions. These insertions are where the muscle attaches to the bone via the tendon. As we get into a more continuum perspective on biomechanics, you may want to look into continuum biomechanics. I did not make that up. You can go find out more on the literature base of how that interconnectivity penetrates at all of the gliding planes of fascia, all of those levels that aren't discrete or separate. They are, in fact, all woven together. And we'll see these tendinous insertions where the more in concentration, put simply here, the red bits, the more reddish colored regions will represent what we are familiar with as muscle. So if you've studied anatomy in your days, you will know the muscles and the bones, and it's likely we study those as separate structures because it's easier to have an understanding of like versus unlike, and to put them into categories makes it easier to memorize the names and understand a bit more about the classification of structures by density in anatomy. So in our perspective on the 5 filaments and the way that the myofascia is inclusive of bone and the integumentary system as well, the superficial fascia as well as the deep fascia, the compartments, and what is contained within the compartments, we're coming to appreciate this whole structure as an axial matrix, or a central structure of woven tissue. This is the anterior view. Those of us studying embryology, we might also call this ventral. The front, we have a ventral cavity where all of those abdominal and pelvic viscera, the organs, are contained in the ventral cavity. And then coming around to the posterior aspect, aka dorsal, the back. And there is a dorsal cavity. If you know what the dorsal cavity is, maybe you could put that in the comments. Looking to get some engagement and participation here. Highlighting this structure, we're going to start naming parts, because that is part of the learning journey, isn't it? To understand these parts and to get an appreciation for how they all fit together. So having a look at the whole pectoralis region, Here in Complete Anatomy, which is the app I'm using, I can remove that deep layer of connective tissue, the deep fascia, and I can add it back on again. And then even as I remove it, making everything look very tenacious, super red, we get a feel for the spaces. There is never any empty space in the body, just like there's no water that's not bound in living form. There isn't ever any space that is empty. So the space that we see here, deep to the pectoralis major, as we remove this one, we are going to get a sense of it curling around on itself and leaving a virtual space deep to that. That space will be full of, it will be invested, and it will be protective of lymphatics and neurovasculature that runs in that space. Okay. Let's hide pectoralis major and get a feel for that space. What is beneath? Now, when we remove a superficial muscle, we will reveal structures that are deeper to that particular structure. Let's have a look at this very superficial structure so we can get it out of the way. If you're interested, you can palpate along the contour of your clavicle, your collarbone, and you will get a sense of that platysma. I'm going to hide that one. Now, revealing structures deeper still. Clavicle, that will be part of the bony aspect. And deep to the clavicle, we have that space where if I show us the nervous system, we'll just add that for a moment, we can see as we get deeper to the pectoralis minor, that we're seeing the innervation, the major innervation here, supplying the arm, the brachial plexus, and all of its trunks and branches are there, coursing in that subclavian space. So deep to the clavicle. It's a virtual space, finding our way into an appreciation of that deep space between the brachial wing, the cape that drapes dorsally and also superiorly over the axial matrix and weaving in with it, the arm structures. So between the locomotor of the arm and the structure of the axial matrix is this very important gliding plane. And if we could just take all of this off easily, I would, but it would take us some time. So I'm just going to leave it there. As you can see, we'll be exploring this structure more in the video on the shoulder filament. So just imagine all of that off. I'll hide that one anyway. We're going to focus now more on the axial structures, the central structures. Finding our way back to the middle, and we'll do a lot of this, zooming out and zooming back in again so that we know our boundaries. So that shoulder filament is something we'll talk about in the shoulder filament video. And the ribs we will talk about today in this axial matrix video. We're going to talk about everything that defines the, sometimes called the abdominopelvic canister, and also its continuity with the thoracic canister, thoracic space, that which is attached to ribs, thoracic attaching to the vertebrae posteriorly. So everything around about there. And the main focus, once again, is the cross ply. As we go through these so-called layers that are woven, like a circular interbraiding of filaments, or a weave, if you like, a tapestry of fibers, you can see all the directionalities. And that's what we're paying really close attention to here. We've moved around posteriorly to look at very superior structures. Here, the lower fibers, the most inferior fibers of the trapezius. So we'll just go ahead and hide those, all of them. So we get a sense of the weaving that takes place deep to the traps. We'll hide the traps, but you can still see all of these diagonals and all of the cross ply. So the big ones for this video, which really is a brief tour, a whistle-stop tour, if you'd like, of axial matrix, where we're going to focus in on latissimus dorsi, noticing latissimus dorsi fibers that are most superior. Those are very horizontal as they come into their tendinous insertion with the midline raphe, if you'd like, the insertion of the myofascia into the spinous processes that is continuous with all of the myofascia that attaches to the back. It's like it's zipped up there as it attaches to spinous processes. The more inferior we view, the more we can see how those fibers thread down, noticing the changing directionality of these striations from the muscular aspect into the more fascial tendinous tissue that's highly collagenous, very organized and regular, very helical, structural, tenacious fibers adhering into that collagenous tendinous tissue. In terms of the organization, you can see that strong weaving effect that dives into thoracolumbar fascia. This is the mooring station for all of the muscles across the lower back and the muscles that wrap around the axial matrix. So we're going to notice here that these fibers on the left latissimus dorsi, the left lats, they will continue down into thoracolumbar fascia, and then they're going to come across to the right side. And it is this crossing that we'll highlight here today, the decussation. As the weave moves down into thoracolumbar fascia, the force transfer happens diagonally, posteriorly, across the back to create a hammock effect of tissue that supports it, weaves together, and allows for mobility across the sacroiliac region, contralaterally from one side of the body to the other. So here is a major site of decussation in the locomotor system across thoracolumbar fascia. So what we're going to notice is that the gluteals pick up that tract of tissue across, so that's laterally, coursing laterally from the midline, and the tendinous insertions there into the iliotibial band, which is misleading to call it a band because there are no ribbons of discrete tissue or bands as such in the body. This will simply be a thickening of the myofascial compartment that encapsulates all of those thigh muscles, all of those powerful quadricep muscles that you see there, right round to the posterior aspect. The iliotibial band, IT band, will be continuous in its force transfer through all of those muscles. Okay, sharing the load transfer also with the bones that are very deep, the central structures. But it's all been named this way and visualized this way for a reason, because that load transfer has evolved for a reason through this very thick density of connective tissue we know as the IT band. It is very much a powerful, centralizing superhighway of force, especially for our athletes doing lots of running, cyclists and multi-sport athletes developing a really thick IT band. It can be so dense because of our insistence on fitness and performance gains that we end up overtraining, and we might be really good at our sport for a few years, but then we have problems with our health and the knock-on effects in terms of daily life and comfort, getting up and down and moving around, when this structure becomes overpowerful and hugs the load and the force transfer, making life for the knees very uncomfortable. And those compensatory patterns and changes in load transfer are trade-offs that we make for fitness gains, finding our way into an understanding that for other sports, what are some other sports we might think of that would, instead of fostering thickness in the IT band, might cause density, hyperdensity in the adductors. Ooh, any sports that might ask a lot of this gracilis could get really super thick, hypertrophic, and the density may pull in opposite direction than the IT band. Okay, so think about what sports might elicit that sort of a response and adaptation from the myofascial system. So when we look at gracilis, we look at the groin. What do you notice? Is those tendinous insertions attach to the anterior aspect of the pelvis, the pubic symphysis there. They do so at an angle, and that angle will continue. It will pick up in the contralateral rectus sheath, as well as those external abdominal obliques on that side. If we like to keep separating things out, we could go through all of those muscles. We're hiding the fascia that covers over that rectus sheath. Now, and what else have we hidden? We've hidden something else as we move through our rectus sheath. Let's see if we can work our way through those obliques as you visualize putting your hands in your pockets. The line that takes your hands from lateral to medial as you put your hands down into your pockets. We go from superior to inferior. We go from lateral to medial. So that's the directionality of those externals. Let's fade that layer. Then we can see the cross of tissue. Can you see the layers beneath where the internal obliques, they're going to show us a different arrangement. They're going to run cross-ply to the external obliques. Hide those. And then we can see the internal abdominal obliques and how those course in the opposite direction, making that pattern. At the different layers from superficial to deep, we have opposing cross-ply striations, creating that matrix of tissue. And this is happening in the myofascia. These long bundles of proteinaceous tissue, the actomyosin, at a cellular level, the extracellular matrix that the cells secrete, right, our fibroblasts and the collagen. All of those will contribute to the striations as well, especially as we start getting into the whiter tissue that you can see indicated in white here, the tendinous tissue. And we can see even that internal oblique is at the cross-ply with the external intercostals. So just for fun, let's fade those external intercostals to highlight that deep to those, we have another level of tissue that is at a cross-ply. Now, external intercostals, we can see that the internal intercostals are running in roughly the same directionality as the internal obliques. So we'll know that those are approximately at a similar depth of tissue. Okay, and then that starts to give rise to the pattern. We see the visualization of this skein of tissue, the organization that winds and wraps around the torso to create and foster stability. Okay, and then as we hide that, there we go. Now we're having a look at transversus abdominis, which is, famous. TA is famous as being that deep core stabilizer. That's the one we're always looking to integrate back to the central line, that linea alba, through the tendinous insertion at the most lateral aspect of the rectus sheath. I'm just going to turn the nerves off for now so we get a really clear picture of those TAs. They don't just run horizontally. There is very much in the posterior aspect of those TAs we get an emphasis on those nisotropic organization. They are not just randomly orientated. The fibers and striations are running in directionalities that relate to the different levels of tissue to give rise to this axial matrix of tissue. This is just an overview. I've picked out certain regions of interest that we can see in a few aspects of this specimen. We talked a bit about the dorsal aspect, the thoracolumbar or thoracodorsal fascia, if you like. And we talked about that major decussation through it from lats to glutes and how that's continuous with the IT band. And then we also talked a bit about the ventral aspect, the anterior, a little bit through those layers, those planes of myofascia in the obliques, especially in the abdominal muscles. We began the talk today with the pectoralis region, and we removed pectoralis on the left side of the cadaver to show the distinction between the shoulder filament, which we'll talk about in another video, and the axial matrix. In any distinction, it has to be at some point an arbitrary cut, and we will look into greater depth at how the shoulder filament is continuous with the axial matrix, especially through the continuity of latissimus dorsi. Okay, I'm going to bring this talk to a close now, although I think you and I could both go on for a little while here on this topic, but I wanted to keep it to about 25 minutes. Please fire back with any questions or into the comments with anything you'd like to raise and bring to light. I hope to see you soon. Thank you.